Pre-diabetes. First thing that you need to know, or you might not have known about pre-diabetes, is first of all what pre-diabetes is. Let me just tell you first. Pre-diabetes, people's blood sugars with pre-diabetes, is not high enough to be considered diabetic, but is also too high to be considered normal, okay? So you're sort of in this in-between range. Your sugar is not normal. It's higher than normal, but it's not as high as what a diabetic's sugar would be. And so that's why we call it pre-diabetes. It's really important to know. Now, this is the thing about pre-diabetes. First of all, 84 million people in the United States have pre-diabetes. That statistic always literally blows my mind, that there are 84 million people in this country, and that's in the US, that don't realize, that have pre-diabetes. That's 84 million. By the way, 90% of those 84 million people do not realize they have pre-diabetes, don't actually realize that their sugar is higher than normal. If you have pre-diabetes, you have a 50% chance of developing diabetes over the next 5 to 10 years. So your risk factors, your risk for developing diabetes actually goes up just by having pre-diabetes. It's another reason why we're talking about this, because it's so important. Most people who eventually get diabetes will have had pre-diabetes at some point. That's right. Now, not all, okay? Some people literally go from nothing to diabetes, and that's not common. That's not the most common situation. But most people who end up being diabetics were pre-diabetic at some point, which is another reason why it's really important to know the facts about pre-diabetes and to know really what the deal is. So the second thing I want to say is that pre-diabetes doesn't necessarily have any symptoms, okay? And I think sometimes I have patients that assume that they must be fine and healthy because they feel good. And I hope my patients feel good, right? I hope you feel good. I hope you don't feel bad. I don't want you to feel bad. I want you to feel good. But please understand that just because you feel good doesn't entirely mean that everything on the inside is functioning optimally. Just because you feel fine doesn't necessarily mean that there's nothing else going on or that nothing else needs to be addressed. So when we talk about prediabetes, the number 2 item is that prediabetes is another one of these conditions where you may be walking around town being pre-diabetic and not even realize it because you feel fine. You very likely won't have symptoms. Most people with prediabetes don't, okay? My number 3 is that just because you are pre-diabetic doesn't mean that you'll necessarily develop diabetes. Doesn't mean that you're necessarily going to turn into a diabetic. And that's the turning point, and that's where really this fertile ground is. That's where there is an opportunity for intervention and change. The good thing about prediabetes, and honestly many types of diabetes and many other conditions, is that actually what we do, how we live our lives, how we treat our bodies, oftentimes can influence the conditions that we have and actually improve them. Prediabetes is one of them. That is the good news. Just because you're pre-diabetic does not mean necessarily that you will become a diabetic. And you also can get your blood sugars to a normal level, okay? Which is very exciting. Things can change, and you actually can get your levels to be normal. Number 4, which is what many of you guys are asking, which is basically what are the risk factors for prediabetes? Meaning, how would I know if I might be someone who's pre-diabetic? How would I know, you might be asking, if I could be one of the 84 million people who's walking around with prediabetes, 90% of which don't even know they have it? Well, we're going to go through those risk factors. Now, keep in mind that many of these risk factors are the same or similar to the risk factors of actually having diabetes, type 2 diabetes, okay? So let's go through them, okay? Age greater than or equal to 45, okay? That in and of itself, your age, if that is your age or higher, that's a risk factor for prediabetes. You should be screened just by virtue of your age. Also, if you have a family history of prediabetes or diabetes, that puts you at risk, okay? So think about your parents, your aunts, your uncles, your siblings. Do people in your family have diabetes or prediabetes? That would be a risk factor for you if that's the case. Also, certain races and ethnic groups have a higher predisposition for being pre-diabetic or even diabetic. Those groups include African Americans, Hispanics, Native Americans, Asian Americans, Pacific Islanders, and some other groups as well. If you belong to any of those particular racial or ethnic groups, you may be at higher risk for prediabetes/diabetes. This should be something that you're talking to your doctor about. But not just for these groups of people, of which, of course, I'm included. This is for all of us, but just understand the things that could put you at higher risk. A history of gestational diabetes, that's diabetes during pregnancy. Women who have diabetes during pregnancy are at an increased risk for getting diabetes later on. And so that becoming pre-diabetic certainly could be something that happens for those who have had gestational diabetes, which is why if you were a diabetic when pregnant and during the pregnancy, it puts you at higher risk for prediabetes. You should know that, okay? You should understand that. Polycystic ovarian syndrome, PCOS, that's a condition that many women have. That puts you at risk. Certain medications also, if you're on like chronic steroids, you're on steroids for certain conditions, whether it's lupus or other conditions, you may be at risk for prediabetes and diabetes if you're on other medications as well. And those who have certain hormonal or hormone conditions, that can actually put you at risk for prediabetes as well, okay? Now, those are some risk factors I think that are very, very important to keep in mind. We call those risk factors, many of those are what we call non-modifiable risk factors. Why do we say that? Because you can't change your age, right? You can't change your family history. You can't control that. You can't control your race. You can't control that you've been born with polycystic ovaries and things like that. But there is some hope here, guys, because as many of you guys have been asking, you're asking, what can you do? Well, let me give you some risk factors that are what we call modifiable. So these are risk factors, things that put you at higher risk for prediabetes that you can actually do something about, okay? One of those is obesity. Obesity is huge. That's a big risk factor for prediabetes and diabetes. We're going to talk about that a little bit more, but your weight, okay? High blood pressure, high cholesterol, tobacco use, and having a sedentary lifestyle, not exercising. Those are all what we call sort of modifiable risk factors. Those are things that put us at risk for diabetes, but there are things we can do something about, okay? Now let's talk about what you actually can do, okay? The first thing is to increase your exercise. That is right. I say get exercise whenever you can and however you can. You know, you don't necessarily have to buy a whole setup to get exercise in or spend a lot of money or do anything that's completely like, I don't know, just out of the ordinary for what you're able to do. Even if all you're able to do is just go up and down your steps, break a sweat, increase your heart rate. Maybe it's walking laps, you know, maybe it's doing getting a jump rope and starting to jump rope in place. There are many, many ways to get activity. Just try to get those steps up. And we know that if you can lose 5 to 10% of your body weight, that alone, not that that's all we want you to lose, but that is enough to make a change. So don't you be discouraged, just start, okay? The second thing is healthy eating. Now we know about that, right? But we know that with prediabetes, we're certainly at risk when we eat more carbs, when we eat more sweet stuff, sugary stuff, carbs. We need to sort of watch our carb intake. So I would recommend going to the American Diabetes Association. That website is awesome because it's got a lot of great meal plans. It's got suggestions for your diets. It's got a lot of really great suggestions, things to substitute. Like if you want something sweet, something you can do instead that's got fewer carbs and maybe it's healthier for your waistline, check out the American Diabetes Association. It's awesome. By the way, also guys, they have a risk assessment tool on the ADA, American Diabetes Association, that you can go in and put like what you weigh, what your race is, what your risk factors are, how much you exercise, to see how much of a risk you are for prediabetes, okay? The other things you can do is you can stop smoking. You can make sure that your blood pressure, your cholesterol are within normal range, okay? And also just making sure that you're seeing your doctor, okay? We are hopefully one of the biggest helps with all this. We are here to help you. And the way that we'll know if your blood sugar is high is to test it. We can test it right in the office when you come. We can do a random sugar. We can do a fasting sugar. We can send you to the lab. We can do all sorts of stuff. We can check an A1C. We can help you figure out if you're one of those 84 million pre-diabetics, okay? This talk is focused on pre-diabetes because I just feel like a lot of information is not focused on pre-diabetics. Make sure you get the results of your labs, because if your blood sugar is just a little bit high and your doctor either doesn't tell you about it, You may not have known that you've been pre-diabetic for a number of years. You just may not have known. Or you may not have gotten tested for diabetes with the A1C to see where you are. Make sure you know exactly what the numbers are and have your doctor explain what they mean. Because if you know that you're pre-diabetic, you can actually make changes that will help improve it. You can actually get out of pre-diabetes. You can actually make sure you don't become diabetic. Remember, see your doctor regularly. Get your blood checked regularly. Make sure you know your numbers and what they mean. And the sooner you jump on things like blood sugar and stuff, the better chances you have for making sure that your numbers are normal. Guys, I love you. Take good care of yourselves. Bye, guys.